This lesson is about the economic and healthcare systems and how they have affected minority groups in America. Before we begin, we must define institutional discrimination. It is any arrangement or practice within a social institution or its related organizations that tends to favor one racial or ethnic group, usually the majority group, over another. It may be conscious and deliberate, as in discriminatory voting laws, or subtle and perhaps unintended. Economic disparity is still present and has not greatly reduced from the past. We still have large impoverished, underemployed, or underemployed underclass. 20 to 25% of African American, Latino and Latina, Native American populations have incomes below the federal poverty line. And these people are excluded from the ownership of major means of production in today's corporate economy. We have to define two major terms. Income is the amount of money that an individual or household receives during some fixed time, usually in the span of a year. Wealth is defined as the total value of all economic assets that people own minus debt. In terms of wealth disparities, we see that median non-Hispanic white household is about 10 times as wealthy as the median black or Hispanic household from 2000. The white median household wealth is $79,400, while the black median household wealth is $7,500, and Latina median household wealth is $9,750. Reasons for this wealth disparity is that whites are far more likely to own their homes than African Americans and Latina Americans. 73% of white Americans own their homes, 47% of African Americans own their homes, and 48% of Latinas Americans own their home. We also have to consider debt, which is zero or negative net worth. 11% of white Americans have debt, 29% of African Americans are in debt, and 28% of Latinos and Latinas have debt. Wealth, more so than income, determines who can afford to live in areas with the best schools and enter and remain in college. And this also is highly influenced by housing and lending discrimination, which we'll discuss in a later chapter. African Americans are relative newcomers to the middle and upper classes. They did not have generations to accumulate wealth and did not have the opportunity to pass down this wealth. This wealth disparity is due to long-term consequences of slavery and stolen land. Relative position after slavery and annexation of land can determine what the current wealth accumulation status is for both African Americans and Mexican Americans. The cost of labor during slavery, including interest until 1987, is between $2 and $5 trillion. African Americans, if retribution did occur, would receive between $136,000 to $340,000 per person. We also have to consider corporate assets and contributing to wealth. This type of ownership is associated with the highest level of wealth. It's highly concentrated. 5% of the American population owns this, and this is considerably overwhelmingly white. Also part of ownership and power is the ownership of stocks. White Americans are 3 times more likely to own stock. White Americans own 2 times more stock than Latinos or Latinas. And white Americans own 3 times more stock than African Americans. 10% of African Americans own stock, and 9% of Latino and Latinas Americans own stock. The reason why these groups are less likely to own stock is that they have less discretionary incomes for these investments, and few minority group members are in positions of true power in these corporations. Gary Becker proposed a theory in 1957, taking a social, psychological, and functionalist perspective. He states that some people have the taste for discrimination. This is cognitive prejudice, so the need and want to be discriminatory. It results in minority groups members not being hired or considered for jobs. He also states that discrimination is dysfunctional for employers and society because it limits the hiring of the best qualified employees. So if you had a Black American or a Latino American who was well qualified in the position, the person who has cognitive prejudice would not hire them simply because of their race or ethnicity. And so essentially they're wasting human resources, which is not beneficial to their business. This, again, harms minority workers directly because they're not being hired. It has the potential to harm the assumed beneficiaries, the white employees, but benefits white employees in general. So again, it benefits the white employees because they have a job, but overall it harms the productivity of the system. So in the whole picture, everyone is harmed because the business is not doing well. This theory implies that the system will work itself out because the business will face competition with companies or employers who are not discriminatory, and they will hire the better employee. And this theory is based on a system of rationality that penalizes irrational behaviors. Some criticisms of this theory is that reduction in discrimination is limited. Intentional and unintentional discrimination still occur, and discrimination is based on stereotypes about Black workers is still occurring. And also, with other research has proven that attitudes are often weakly linked to discrimination, as we saw with those varying types, that you don't actually have to be discriminatory to be prejudiced, and vice versa. Another theory to take in consideration is the split labor market theory. It states that discrimination is a result of social structures rather than individual preferences, and this is a conflict theory. And this is due to competing interest groups. So we have the elites, the business owners, and they have various workers. One is more of the middleman position, like the white working class, versus all others, and they will compete for any kind of benefits they may receive. In this theory, the employer or business owner recognizes that discrimination is beneficial to them, and they may or may not prefer to discriminate. But they do this to get the best worker for the lowest wage. So their primary concern is profit. Discrimination limits the pool of available workers. This theory speculates that the employer is forced to discriminate by the white laborers. So the laborers, in this case, may strike or have some kind of power to say they don't want who they do not want to work there. And this limits competition from minority group workers and keeps the wages up. White laborers are able to impose a system of discrimination by preventing minority group members from obtaining the skills by demanding educational discrimination, by also excluding minority group members from a territory entirely, and keeping minority laborers out of its segment of the labor market by keeping them out of unions. So again, preventing them from getting education, preventing them from living or working in a certain area, and of course, keeping them out of unions, which protects their work. Some criticisms of this theory is that it's effective only in the short run, that split labor markets will not benefit everyone, especially the working class who's discriminatory, because minority group members eventually become strike breakers and they will get the job and the wages, although they are lowered. Majority of workers do not have so much control over hiring, so The idea that the workers have pressured the employers to not hire minority groups is very limited. Usually they don't have that much power. Next, we'll talk about Marxist theory. Again, it's a conflict theory. It states that the working class and the poor are disadvantaged regardless of their race. So in this case, class is trumping race. And according to Marxist theory, employers or capitalists gain and white workers lose as a result of discrimination. This is a divide and conquer tactic using race. And by using race to divide the working class, the minority groups and the dominant group workers are unable to recognize their common interests. Racism is seen as a tool that owners of wealth use to keep the workforce divided and weak. And this, of course, weakens the unions and lower wages for both groups. Another conflict theory is internal colonialism theory. It states that racial divisions between dominant groups and colonized minorities are more important than class, like the other, in reverse of the other. So in this case, class is not as important as race. Race trumps. Colonized minorities are subjected to discrimination and exploitation. So those who came to the United States voluntarily, although immigrants are benefited more so than those who came here by forced labor, slavery, or annexation of land like Mexican Americans. Criticisms of this is that the theory does not directly address the question of who within the dominant group benefits. So it's not all white people benefit, but they are privileged racially, but they do not all benefit in the same way. So we have to consider taking an intersectional approach and addressing class. We see here that the white working class does not benefit as much as whites with more status, such as the upper class, the elites. So we have rising educational demands and the employment of minorities now to consider. We now have the expansion of white-collar jobs, and this has increased in minority middle-class populations, so people in the middle class are able to access these types of jobs more so these days. We have, however, these jobs have increased educational requirements, so this also puts a hindrance or obstacles in place to keep certain groups out. So this has caused problems for a large segment of the population. We see in certain jobs that education is not always needed, and some jobs have become automated, so machines and factories. And these jobs used to be centered in cities, and minority groups worked and lived in these areas, and now the jobs have gone overseas, and now we have cities with high concentration of poverty. Some jobs require higher levels of education. So again, if there's educational discrimination happening, this keeps groups out. We have increased average education of the population. So even if education, higher education is not needed, you just fit better with the company because you have similar culture now. Also, having a better or higher education assumes that the individual will work better with little supervision. The problem is that inflated educational requirements may be one cause of high levels of unemployment and poverty in communities of color. So again, these jobs don't necessarily require these types of educations, but again, it's put in place to keep people out. The 1991 Civil Rights Act banned unnecessary educational and strength requirements for certain jobs, and people are able to take legal action against discriminatory policies and actions in the workplace. However, this did not lead to any groundbreaking court rulings and did not increase minority representation in fields where minorities are underrepresented. So the law changed, but nothing really came of those laws. So problems with the cities especially with jobs leaving, and then people living in areas in the cities, as that the property values also are affected. The problems stem from tax system that requires local financing of city services, and with the loss of industry, you don't have those tax dollars. We have the loss of middle class population, so you have the loss of potential homeowners, business owners, and also mentors to bring up the youth to want to be in middle class positions. We see an increase in concentration of lower income population, so we have a concentration of poverty where these jobs used to be. We also see a shrinking federal aid, which strains the state aid because they don't have that compensation to help. Cities are forced to raise their own aid through local taxes and utilities, and without property taxes, we have limited resources in cities. We have cutbacks on services and assistance programs, so programs that would help the poor, because they don't have this aid to help build and maintain these programs, are gone. School districts and municipalities are also funded by property taxes. And again, if you don't have property taxes, you have no resources, you don't have a way to pay great teachers, you have restrictions on what your students can learn and what activities they can do. Cities with the most need are unable to raise money for services and assistance programs, again through lowered property taxes and a concentration of poverty being these issues. And businesses and middle class leave, and because of this are unable to raise sales and income taxes. Now we're going to move on to healthcare and how it affects minority groups. Mortality differences may not have to do with healthcare, so how groups die in terms of patterns. Overrepresentation in jobs that are more dangerous than others is one of the problems. So they're doing work that is dangerous or has more toxins in the environment. And this is environmental racism. Farm workers, typically people of Mexican descent now, are exposed to pesticides, which causes higher rates of cancer. Black communities are located near industrial facilities that release pollutants in the air and water, so more issues dealing with asthma. Blacks and Latinos are more likely than any other group to live in older housing with lead-based paint, and this causes a lot of mental and intellectual development problems. Native American reservations are dumping grounds for nuclear waste, again causing many health issues. Again, mortality rates don't always have to do with healthcare. We have poor nutrition and inadequate shelter associated with poverty. So if you don't have good food, your body cannot replenish itself, and then it cannot heal itself. And also inadequate shelter. If you have housing that is in ruins, you may not have protection from the environment, from the elements, so you may get sick more. In addition, minority groups suffer stress related diseases such as ulcers and hypertension. Stress is and can be induced by racism. High blood pressure, African Americans and other groups have high blood pressure when confronted with racism, and also when they do not fight back against this racism. Minority groups have more encounters with discrimination, and this is related to medically verified health problems, including heart issues, such as heart attacks and high blood pressure. Other things that may cause higher mortality rates is behavioral factors. Black males are more likely to smoke than white males, and this may be a response to stress, so they go out and smoke a cigarette to relieve stress. Blacks are more likely than whites to be victims of violent crime. Black men are 7 times as likely than white males to die from homicide. And this is not a case for black on black crime. People are more likely to die be killed by people who look like them because they tend to live near them. So next we have to consider health insurance. Healthcare is expensive and is based on an ability to pay. Buying or arranging for private sector insurance, paying out of one's pocket, or the combination of the two is how people tend to pay for healthcare. The U.S. is the only industrialized country without socialized medicine or national health insurance. The U.S. spends more money per capita on healthcare than any other country in the world. We spend more than $5,700 per person. 47 million Americans lack health insurance as of 2006, and medical expenses had cost 40% of bankruptcies in 1999. Health is becoming more expensive. A disproportionate amount of poverty, part-time employment, and unemployment has affected minority groups' ability to afford health care insurance. 32.1% of Latino Americans and Native Americans do not have health insurance. 19.5% of African Americans do not have health insurance. 16.7% of Asian Americans do not have health insurance, and 10.4% of white Americans do not have health insurance. The uninsured are usually those whose incomes are just high enough that they cannot qualify for Medicaid and whose jobs do not provide insurance plans. Medicaid goes to minority adults or to adults who do not meet a certain federal poverty line. Minority adults are more likely to be covered under Medicaid than white adults. 24.2% of African Americans have Medicaid, 22.4% of Latinas, 14% of Asian Americans, and 9% of white Americans. Minority children are more likely to be covered under Medicaid than white children. 40% of African American children are covered, 40% of Latina children are covered, and 20% of Asian American children are covered, and a quarter of white American children. So also we got to consider those who have no insurance. Minority children are more likely to be covered under Medicaid than white children. But those who have no insurance, that's 14% African Americans, 22% of Latinos, 10% of Asians, and 7% of whites have no insurance. Minority group members, on average, receive medical care, and particularly preventative care, less often than whites. And this is due to poverty and the cost of medical care. Minority adults are more likely to go an entire year without seeing a doctor due to lack of insurance. Minority children are more likely to go an entire year without seeing a doctor. Now I'm focusing on children without insurance. Minority children are more likely to be covered under Medicaid than white children. However, 14% of African American children do not have health insurance, 22% of Latinas, 10% of Asian children, and 7% of white. We have to also take into account the frequency of seeking medical care for minority groups. Blacks and Hispanics tend to avoid contact with professional medicine to a certain degree. Instead, they may seek healers. They do not make distinctions between religion and science in the treatment of illness. And they want to address the causes of disorders, not the symptoms. In addition, seeking healers may provide positive effects on mental outlook. The extent to which the use of traditional medicine keeps African Americans away from doctors is overstated. Most use medical doctors, some use both in combination, and few only use traditional medicine. And again, they may seek other types of doctors or healers because of lack. Next, let's talk about the availability of healthcare personnel. Medical services are not readily available to various communities. Inner city neighborhoods with large minority populations and rural areas have relatively few practicing physicians. The general doctor-patient ratio is 1 doctor to every 480 patients. Areas with large minority populations have 1 doctor to every 3,300 patients. Doctors are not attracted to these areas because they may view that patients may be unable to pay, that the hospitals lack updated technology, and that they will lack networks of other practicing physicians for referral and social networking. There are very few minority doctors, at least measured by 2006. There are very few minority doctors as of 2006. 5.3% of physicians are African American, 5.6% are Hispanic, 0.1% are Native American. Minority doctors are more likely to be located in minority neighborhoods and medically underserved areas than white doctors. 40% of minority medical graduates plan to practice in underserved areas compared to 9% of white medical graduates. 11.5% of medical school students are minorities. In addition, minority doctors may want to work in these areas due to cultural familiarity, and why white doctors would not want to work in these areas because they feel like they would have a harder time understanding their patients. Also, by matching patients to doctors culturally, there's better doctor-patient communication. Middle-class people are likely to have a private, personal, or family physician, and they are able to maintain records and medical history. They're also aware of existing preconditions and know the patient as a person. The poor receive their treatment from emergency rooms, hospital clinics, public hospitals, and Medicaid mills. This is usually their source of primary care, and the relative shortage of physicians in the areas where many minorities members live may be also a reason why they go to these various clinics. They also lack the advantages of private care that we listed before. Even when insurance status, income, age, and seriousness of medical condition are the same, minorities fare worse than whites in the U.S. healthcare system. Minority patients do not receive the same treatment as white patients, controlling for symptoms and appearances. The racial composition of hospitals' patients influences the care provided at the hospital. They are less intensive. The procedures are provided in minority-based hospitals, and they also have higher mortality rates. Doctors treat patients differently due to race. The Medicaid program is a federally funded program administered by the states that provides medical care to the poor. The coverage varies from state to state, and is limited mostly to the poorest of the poor. It excludes many households with incomes below the official poverty level. 13.2% of the population is covered by Medicaid. The problems that may occur is that many doctors will not accept new patients covered by Medicaid. Medicaid pays at lower rates than private insurance. Doctors cannot bill patients for the difference. We also see Medicaid mills. It treats large numbers of patients in a assembly-line fashion and gives as many treatments as possible. Sometimes these treatments are not needed. Also, there's major issues concerning fraud to help build profit for doctors.